Good evening, everybody. We have a good group coming. My name is Denise Woltrain Vargas. I am at Tulane University's Stone Center for Latin American Studies. I coordinate outreach and educational programming. And I'm excited to be here on our third webinar of the series, Coronavirus in Latin America, co-sponsored by Vanderbilt University. My colleague over on the squares here, Colleen McCoy, is one of our sponsors. And we're really excited to be hosting tonight's theme on the effects of coronavirus on human rights in the Northern Triangle and Central America. So as you know, if you've come to these before, there will be time at the very end for question and answer. Our moderator, I'm gonna just mute you, Noah, for a moment. Okay, so one of our speakers is trying to go away from a storm, run away from a storm, but he will be joining us, so I will unmute him. But everyone else is here, and our moderator this evening is PhD candidate Nico Cabrera Schneider, who moderated our last webinar a couple months ago. He holds an MS, Master's in Science in Ecology and Evolutionary Biology, and a Master's in Anthropology. He is currently focusing on international policy outcomes in local communities and has published on the effects of the DR CAFTA on local communities and political party comparisons between the United States and Guatemala. He has researched Nicaragua's South Caribbean coast, the Caribbean coast, the autonomous region, as well as in the Western Highlands, Northern subtropical forest, and the Caribbean coast of Guatemala. He has been a real resource for us when we do these webinars, so he will lead the conversation. I hand it over to you, Nico.
Thank you, Denise. Today we're talking with Osvaldo Lapuente and Noah Bullock, and let me introduce them to you. Osvaldo Lapuente is the National Coordinator of Cristosal in Guatemala, an organization that promotes human rights in Central America. He is a lawyer and notary, graduated with honors from the UNLP in Argentina, and has also completed studies in international relations and a master's degree in public policy at the URL in Guatemala, with scholarships from the OIS. He also held an internship with the FIIAPP in Spain. He's a former member of the Institute of International Relations at the UNLP, the Center for Argentine-Canadian Studies, and the Institute of International Law at La Plata Bar Association. With extensive experience working on social issues, he became a United Nations officer in 2003, where he served in several relevant positions. He was an international consultant for the OAS, SICA, AECID, and USAID, other institutions, universities, and foundations. He is author and co-author and collaborator in more than 15 public policies in Central America, and former university professor in several countries in Latin America. He has published several papers in his area of expertise. Noah Bullock is the executive director. Noah first came to El Salvador as a human rights intern for Cristosal in 2005. After graduating from the University of Montana in Peace and Conflict Studies, that first year he evolved into more than a decade of crafting human rights-based programs to address problems from hurricane disaster relief to community development. In 2007, Noah became the Community Development Program Director. 3 years later, he became Cristosal's first in-country executive director, while also earning a postgraduate certificate in local development from the University of Central America, Simeon Cañas. Noah sees at the heart of Cristobal's mission the challenge to redefine human rights mechanisms and states' responses to address today's human rights violations. Human rights were thought to me as a historical process, and every generation has to be able to understand human rights and violations in their own time. Our moment has changed significantly from when those frameworks were established. So we are challenged now to find ways to apply these same principles in promoting to address our moment's greatest challenges of displacement by violence, poverty, and inequality. So with that introduction, I will start the conversation asking Osvaldo Puente to set us the context on what was the context of human rights in the Northern Triangle in Central America before the COVID pandemic, and what are we seeing right now? So Osvaldo, what is your perspective on this? By the way, you're mute. Sorry, let me. Thank you.
Thank you, Nico. Hi, everybody. I want to thank to the Stone Center for Latin American Studies for this opportunity, for this interest in knowing the situation in the Northern Triangle of Central America, and also to the Tulane University and Vanderbilt University too. As introduction, I want to share with you a general umbrella, some opening remarks for frameworking this conversation and interaction with you. And obviously some main ideas, core drivers, statistics, and figures about the human rights situations prior to the crisis of COVID-19 in Guatemala, El Salvador, and Honduras. The first one, the general umbrella, is authoritarianism.
Coronavirus.
Can you hear me?
Yes.
Yes? Okay. As you know, authoritarianism is a major trend in the Northern Triangle as a result of the long period of dictatorships with violence, repression from the state, but also as a result of the colonia in the countries. This general approach is important, and we have to keep in mind this idea, because all the political, social, economic, and human rights situation is related to this authoritarian reality in the region. We have three core drivers when describing the human rights situations prior to COVID-19. You already know that Honduras, El Salvador, and Guatemala are in the list of the poorest countries in the world. So you can imagine that the situation is not getting better as a result of the COVID-19. These three core drivers are, for starting our conversation, structural impunity and reduced access to justice, human and social development lack of, obviously, and third, organized crime, narco activities, and illegal networks. So we have a list of figures, numbers, and ideas to frameworking our conversation. More than 95% of impunity in general, talking about the cases injustice in the three countries, widespread corruption and weak governance, lack of judicial independence, persecution and criminalization of brave and fair judges, prosecutors, and the few national authorities doing the right things. Urgency for judicial reforms, including constitutional adjustments. Insufficient financial, technical, and human resources for justice in the three countries. And deficient accountability for past gross human rights violations during internal wars. The second core drivers, some ideas and statistics about the human and social development in the region. Half of the population lives below the poverty line. Rural poverty is widespread. Honduras is the worst affected. 75% of the country's rural population lives in poverty, and 63% live in extreme poverty. Guatemala is next. 54% of its rural population lives in poverty, and El Salvador have 47% of the rural population in this condition. Indigenous population, the majority of the population in Guatemala, for instance, have the highest rate of poverty. They also have the lowest lowest income, and lack access to much needed services. High rates of low birth weight in infants, as well as high rate of malnutrition among women, infants, and children, worst for indigenous people. Also, we have to talk about general lack of access to healthcare, education, social benefits, legal and formal employment, to opportunities in general. Also, in the discussions, it's important to mention the denial of sexual and reproductive rights, services, sexual education, criminalization of LGBTIQ people, hate crimes, torture, and persecution against them. And note that we are going to talk about this matter later. Racism, a major trend affecting indigenous people, including constant attacks and actions against indigenous authorities. Also, structural and multidimensional violence against children, women, LGBTQ people, journalists, human rights defenders. And as you know, migration and remittances are key factors when trying to understand the region. And the third core driver for trying to understand the situation prior to COVID-19, organized crime, narco activities, and illegal networks. And we find epidemic violence and crimes by powerful criminal organizations. Also, gun-related violence is an important factor, prompting people, including unaccompanied children and young adults, to leave the country, migration, internal displacement, etc. And last, high percentage of cocaine and other drugs passing by the region to the US. According to some agencies, we are talking about maybe 70 or 80% of it, of drugs, of cocaine. Related to them, money laundering, human trafficking, arms, and diverse smuggling. So these are items, figures, and statistics, or main ideas for trying to understand the situation in Guatemala, Honduras, and El Salvador prior to the crisis of COVID-19. So can you imagine the consequences of the pandemic when this lack of institutionality, rule of law, and human development is a reality in these countries for a long time ago?
Thank you, Osvaldo. So that introduction set us the context on how the situation was before the pandemic. And now with the pandemic on top of us, are you seeing a new or different kind of human rights violations or issues that are emerging that are related or have been worsened by the pandemic?
Sure. I don't know if you know I want to answer or I just move forward.
Sure, I'll answer and then you can fill in whatever I miss. But I think just like anywhere else in the world, the pandemic has been like a magnifying glass that kind of helps reveal all of the issues that Osvaldo mentioned and the way it's sort of the things that are the structural problems in our societies, right? So trends of securitization, the militarization of public security, generalized violence, corruption, impunity, rule of law issues, governance issues, the centralization of power and trends towards authoritarianism have all been accelerated under the pandemic. Especially the issues of the governance issues. As I think the common sort of trend in the world where in moments of emergencies, governments generally use special powers to respond. Usually in moments of emergencies, we concentrate power in the executive so that they can respond quickly and hopefully rationally based on science. or technical criteria. But in the pandemic in El Salvador, Guatemala, and Honduras, in the context of weak rule of law, sort of weak democratic institutions, not well established separation of powers, the conferring of additional emergency powers onto the executives has led to a rapid concentration of power, especially in El Salvador, but definitely in the other two countries as well. And in that context, in El Salvador specifically, at the outset of the COVID crisis, the president declared with a legislative decree a state of emergency, and El Salvador entered into what ended up being one of the longest and harshest crackdowns or lockdowns in the world. And the trend of militarization, securitization becomes increasingly important, because in the response to the public health crisis, it wasn't public health authorities that were leading the response, it was military and police officers that were leading the response on the streets. And so, as you can imagine, when those are the circumstances in Central America, usually that leads to bad human rights outcomes. In El Salvador, the government detained 13,000 people on the streets and at the borders. They held people against Supreme Court rulings saying it was illegal for police and soldiers to detain people for breaking curfew or the quarantine. They continued to do that practice and held people for 60 or 70 days in what they called containment centers. The president, in response to an outbreak of violence that was driven by one of the gangs here, the Mara Salvatrucha, 85 people were killed over the course of 3 days. And then the president gave, or sort of on Twitter, authorized the military to use lethal force to contain the violence. And in that context, Cristosal began to see cases of extrajudicial killings and torture. And so that's kind of the slippery slope. There's, in times of emergency, there's always a trade-off, recognizing that it might be necessary in a limited way to restrict fundamental freedoms, and in that sense make a trade-off with the emergency response and human rights. But in our context, where the checks on powers are limited and democracies are weak, and the trends had already been going towards militarization and authoritarianism, those trade-offs have had a big impact in terms of political and civil rights. And I would say that in the lack of technical criteria to orchestrate the responses has had a dramatic impact in the social and economic rights of the population, as Osvaldo led to. In Guatemala, Honduras, and then later in El Salvador, you had the phenomenon of the white flags, where populations, people who ran out of food would put out white flags indicating that they were in need of help. And deportees, and during this whole crisis with the economy shut down, each country received over 3,000 deportees individually. And so overwhelmed public services, overwhelmed governments had to try and find ways to create quarantine centers for them. And then at the community level, people who returned during the pandemic often weren't being allowed to enter into the communities because of fear. And so sort of a lack of good information that ended up making so some people couldn't even end up being like internally displaced people as a consequence of the pandemic. So that's just a kind of an overview, but I don't know if Osvaldo wanted to chime in with some fill in the gaps there that are left open.
There are not gaps. I want to use two concrete examples. For instance, as Noah said, we are witnessing more cases of human rights violations and more concerning cases. So the COVID-19 is just intensifying the human rights violations. And I want to talk about two particular human groups in this vulnerable situation. For instance, trans women. I know that we're going to talk about it later, but this is an important matter because we are counting a lot of hate crimes, homicides, and this type of felony and discrimination against them. And this is total connected to the COVID-19 lockdowns and curfew. And as a consequence, they are more exposed to violence, corruption, and in general, hate crimes. And we saw also in this new context, waiting for the new normality, or we don't know what to expect. But for instance, we hope this crisis of stranded Nicaraguans at the border between Guatemala and Honduras. And this is really important because what we're seeing in the migration flows, and you know, migration, it's a key item for describing, understanding the region. It's this phenomenon with the capacity of explaining all the reality in these countries, the lack of opportunities and violence and etc. And for the first time, we are witnessing the change of the flows because suddenly people want to return to Nicaragua. They were leaving their country for political persecution or etc. But considering the pandemic and the COVID-19 for family reason, for economic reason, or wherever, they want to be with their loved one, or I don't know the reason why. But we are witnessing these different behaviors of the flows of migration inside in the region. So these are two concrete examples of the new menaces and human rights situations that we are helping or managing in the region. Vulnerable groups in a worse situation, and also these new trends in migration generating a lot of, because we are accustomed or we are used to hold the usual caravanas or migration in general, you know, to south from south to north. But these days the situation is mixed and we are witnessing different directions of the migrants.
I just add, I know we need to keep moving, but I just want to add a couple really important scenarios here. Is that the pandemic has also served as a pretext for criminal groups and the state to pursue agendas of persecution against perceived enemies. And in Guatemala, you see in the last 3 weeks or so, the president using what we call like states of siege or states of prevention, which are, again, emergency powers generally reserved for moments of armed conflict, to militarize territories, mostly in indigenous communities that had been organized to oppose mega projects. In Honduras, 2 weeks ago, maybe it was 3 now, 4 Garifuna leaders who were also opposing the appropriation of lands were disappeared. And we may have found that the remains may have been found already, but it's not been confirmed. And in El Salvador, attacks against journalists have been systematic and really unprecedented in the post peace accord era, of attacks on journalists from the executive. So just to mention a couple of those scenarios that have become increasingly worrisome. And I think Oswaldo already said it, but also killings of trans women. In Honduras, last month there were 2 murders and 1 disappearance of a trans woman. And those crimes have not been adequately investigated or prosecuted.
Thank you. It seems that Cristosal has increased their workload immensely. Terrible times. So talking about the Cristosal's work of victim accompaniment, how is this new scenarios of curfew restrictions and social distancing and the estados de prevención you mentioned in Guatemala, how is this affecting your effectiveness of working in that frame of victim accompaniment?
We've had to adjust. Yeah. When the lockdowns happened in El Salvador, Cristosal, I think, was probably one of the first organizations to kind of reorganize and sort of come online with our capacities to represent victims and to do advocacy. And we did that primarily launching an online reporting mechanism where people could report to Cristosal things that were happening, and we set up referral networks with the Human Rights Ombudsman here in El Salvador and in Guatemala to be able to follow up. We got sort of permits to move around the country in a limited capacity to be able to verify cases. And really one of the, I think, big areas, especially in El Salvador, was the reorganizing of our legal team, because right at the outset of the lockdowns, the government here was using, it's a kind of a constitutional technicality, but the way that they were declaring emergency powers was unlawful. And so Cristosal was the first organization to use the constitutional court of the Supreme Court, with the highest judicial authority in the land, to begin to challenge unlawful declarations of emergency powers. And then once the detentions began, we set up, we had to actually get into contact with the Supreme Court to set up an email account for them, because prior to the pandemic, they could only receive claims either at their administrative windows in person or through fax. So we one of our junior lawyers basically set up an email account for the Supreme Court, and we began to send to that email account habeas corpus claims to try and get people free who were illegally or arbitrarily detained in the context of the lockdowns. So that was kind of the original shifting, and from there, that we've, I think, changed a lot in the sense that we have almost like an open referral system now, where we're in Guatemala, for example, we launched the online reporting system, and if there are human rights abuses and people report them to us, then we take them on, we look at them. And whereas before we had for security reasons, we were much more closed in our referral networks. Our protection teams and legal teams have had to, really develop new techniques to do psychosocial assistance and legal assistance on the telephone, which I think has been a big challenge. So there's been a number of kind of COVID shifts that we've had, or pivots that we've had to go through. But I think that those are some of the principal ones. Obviously, Cristosal's office is still closed. I came to the office this afternoon because there was a hurricane in my house and I had to leave. But our office is closed, so we've had to shift to like an all virtual working environment. And I think in some ways, that's been good too. It's helped us kind of improve our internal communications and things like that. So I don't know, Osvaldo, how do you see it? Guatemala has been a little different too.
Yes, I want to share 3 lessons from experience with you. The first one, considering the general overview on human rights, we learned that the general guidelines for fighting against COVID-19 are not useful for the poorest countries in the world. For instance, washing your hands, social distancing, and the lockdown/curfews. Social distancing, when you have in the rural areas or even in the urban areas in Guatemala, but it's the same situation in Honduras or in El Salvador, you can find several generations and several families living under the same roof. So social distancing is not an option when talking about your possibilities for fighting against the virus. And also when you don't have public transportation, because as you know, We don't have train, we don't have subways. You only have these really engines, buses with any secure measure in general. So to commute, it's really impossible. And social distancing in your house and in the public transportation was and is impossible. So this is not a rule to follow in this type of country. Washing your hands. When the majority of population have not running water or even water, it's not possible to wash your hands. So this idea of you're at the driving seat of your health and you can do it for yourself and etc. is not useful also in this type of countries. And the third one, we are witnessing these days the consequences of the healthcare situation, talking about particular cases and people getting sick. But the economic consequences, the economic tsunami arrived before, the healthcare situation. Because as you know, the majority of population and their livelihood depends on informal ways to survive, you know? So the lack of real employment and the combination with curfew and lockdown was devastating and is still devastating in this type of countries with this poverty, extreme poverty and malnutrition. So this is an important lesson, and it's really important to understand this because this type of guidelines has to be adapted to different environments and realities. And talking about human rights defense, discussing this during the pandemic, you know, we were really flexible, creative, and as Noah said, we implemented a lot of mechanisms and ideas. We went to innovation, we jumped for making things in a different way and still defending human rights in this really hard time in the Northern Triangle. What we miss, for being honest, is the face-to-face interaction. And this is really important when working on human rights, because you need all the information. We applied this approach of victims at the center. And this is not just, a phrase. This is reality. We work with them hand in hand, and that our process are driven by victims. They are the real core, they are the heart of our work. So not having the face-to-face interaction, the human possibility of conversation and body language, all the information that you get when you are directly communicating with the victims or their families, their social families, when you're talking about a deceased person, for instance, blah, blah. So we really miss this face-to-face interaction, and it's not the best situation when defending human rights. And the second one, the local approach, the community level, the grassroots organizations, the indigenous leadership and authorities, it's really important to go to the rural areas of the countries. It's very important to live the situations with them. And under these circumstances, we are isolated, they are isolated, we cannot trip to the field, and we cannot have the usual direct contact with the community level. So those are important factors, items to consider when human rights defending in Honduras, El Salvador, and Guatemala during this time of pandemic.
Thank you. I want to shift a little bit to another area of work from Cristosal, and that is your strategic communication and public action to increase solidarity with LGBTIQ individuals and communities how in this new era, how is this strategic communication programs are adapting, or how you're seeing it beneficial for expressing your message, or adding to it a component of prevention for the pandemic?
That's been one of the areas where Osvaldo mentioned innovation. We've had to try and innovate the most is in our communications, because our contact to people, because what Osvaldo also mentioned, is not person to person. We have to find better ways to communicate and advocate through social media, traditional media, and kind of at the community level as well, trying to know what are the channels that people in communities are using to receive information. And in the context of the emerging or resurgent or authoritarianism, there's a lot of disinformation. There's a lot of false information. The executives have used their resources to create shadowy networks of communications and fake news outlets. And so that has been a big challenge in trying to be able to get our messages out, to try and help inform the population. The big communications challenge in the pandemic has been, especially in El Salvador, the narrative, the populist narrative that the president uses is, if you don't obey me, if you don't do what I say, hundreds of thousands of Salvadorans will die. And so he says, basically, he frames everybody who does anything to check his authority or to check his power as a group of persons or people who want Salvadorans to die. So when he says that journalists, the Constitution itself, human rights defenders, the medical college, all these groups of people who have questioned his response in the official communications get painted as, in the Legislative Assembly specifically, as obstacles for the president, and groups of people who therefore want hundreds of thousands of people to die. So we have to counter that narrative, and it's been really challenging to counter those narratives. Talking about constitutional human rights standards, because it's such a black and white message that the president has. If you do what I say, or hundreds of thousands of people die. And then we have to come and say, but the way that you've declared the emergency law wasn't right, because you didn't use the word restrict and not suspend, and that's not, so we have to find a way to transcend what we call human rights process messages, and try and be able to communicate better human rights results messages. So human rights process messages are, when in compliance with constitutional standards, norms, all these things are serious violations, but not necessarily effective communication messages. We need to be able to tell people how their lives are better, because when human rights are and constitutional standards are respected, and how their lives collectively and individually are worse when they're not. And so that's a framework which we're trying to evaluate our messaging, our human rights advocacy, and it's not easy. It's a big challenge. And in relation to LGBTQ hate crimes and things like that, there are powerful messages out there about dehumanizing those populations, that they are conservative groups that say that these are people who live in sin, that they don't exist, even language that goes as far as applauding extermination type of language. And so our communications campaign was specifically on the trans justice issue, is just getting going. Part of what we try and do is contribute to other trans and LGBTQ organizations in helping make visible acts of violence and challenging the normalization of it. We think that's one of our roles, is we're not a specifically LGBTQ organization, but when we add our voice to those, to the claims that the LGBTQ community are making, we feel like we're helping to make it so that it's not something that you could just isolate. Oh yeah, that's what those people say, and try and link it into human rights more broadly. So that's what we've done, and trying to also, when there have been these brutal, when we say there have been brutal killings, you know, Guatemala, the two of the cases that we have been looking at were stoned to death. So the killings that are lynchings, they go beyond just acts of violence. They're messages that challenge the humanity of the entire group of people who are affected. And I think that part of what we're doing right now, communications-wise, is just trying to say and point out how outrageous that is, how unnormal that should be.
Yes, and could you see the results now in the new case of Camila Diaz? Would that be part of the effectiveness of this part of your campaign? How that process went into trial and justice was achieved?
Yeah, I think that's a case of, I don't know if I like the term mainstreaming, but like the collective pressure against impunity that the LGBTQ community has advocated for and built is, I think, part of what has led to the conviction of police officers. 3 police officers who were sentenced for 20 years in prison. That's unheard of in these types of cases. And I think that is what it's responsive to that general sense that those are no longer acceptable behaviors. On the other hand, you know, we'd like to see, before we can celebrate too much, we need to see a pattern of justice, because the pattern of impunity is so long standing, and not just on LGBTQ population, but women. You know, in El Salvador, there was an emblematic case of a female police officer who was raped and disappeared by her own colleagues. In that case, largely is still in impunity. So what we'd like to see, we're excited about that case that ended in justice, and I do think that that's, you know, a consequence of continued pressure. But there's a risk that could be seen as, look, we did this one thing, and now everything is better. And what we'd like to see is a pattern of justice. It's just as long and strong and historic as the pattern of impunity.
Interesting, yeah. So another component of the work that Cristosal does is protect the human rights of incarcerated individuals. With this recent, we talked a little bit about the penitentiary law earlier. How are you able to monitor the violations of incarcerated populations when there's limited access to that scenarios? Are you innovating in that aspect, or?
There are populations in the prisons that have had no access to the outside world for 5 years, meaning that their lawyers, their family members have not been able to come to the prisons to visit them, and they haven't been able to leave their cells. So you can imagine having been locked down in a small space where you kind of take turns sitting and standing for 5 years without leaving. A year and a half ago, I was able to visit several maximum security prisons. Is one of the first sort of openings to outside groups, and that was during the previous president's administration. We went with the Presidential Commissioner for Human Rights, which is a figure that doesn't exist anymore. And it was an experience that I had never had before in my life. In one of the sectors of the prison, you saw men with little plastic, we call them wacals, little plastic bowls, trying to shovel the excrement out of their cells because the sewer system was overflowing into their areas. No clothes, emaciated. It looked something similar to photos that you would have seen in like the Holocaust. Probably not quite as extreme in terms of malnutrition. So the situation in prisons is very grave. With the new president, he's used images of prisoners to stoke a sense of sort of a bellicose war narrative that he's waging a war on the gangs at a level that's never been waged before, which there's not really any evidence of that, but uses these images of like basically naked gang members sitting back to back to back. Some of those images were published in the New York Times, and he uses that as like kind of a dehumanizing imagery to the population, to say that basically these are people who are not worthy of life. And it's that was really what is striking, is that was his first public, a president who's known for his communications capacities. His first public communications campaign was that one, where billboards all across San Salvador with photos of hundreds of half naked, mostly naked gang members sitting back to back to back to back to back next to each other. And then when he did that again during the pandemic, you think they put masks on these like basically naked prisoners, and you think about the potential for outbreaks in the prisons. We know that there have been thousands of cases of COVID in the prisons documented, but as you said, because of the lockdowns in the prisons themselves, there's not real access. What we know mostly is through family members who, in the prison system here, it's the families that bring food and medicine to the prisoners. And when they aren't able to do that, you assume that they don't have access to food or medicine. And so those are some of the kind of deductions that you can make to imagine the conditions in the prisons right now. But that has become a really difficult advocacy point, because the president has chosen prisoners as one of the populations that's sort of at the core of his security strategy, right? And his own messaging that these are terrorists, that these people should receive the terrible conditions that they're being given because of who they are and what they've done. And so what we've tried to do is to counter that by saying that type of violence doesn't do anything to help end the cycle of violence. When you torture people in prisons, you shouldn't expect them to be, better citizens once they leave prisons. That's kind of reducing it to a very pragmatic argument. And we've also tried to make visible the families, to try and humanize prisoners. We're actually going to launch an animated series about families families of prisoners that we would try and get, in different types of channel out through different types of media outlets here to try and help put a human face on these people. And our overall message is trying to say that this violence in the prison won't make you any safer, and it probably makes us less safe. So it's been a challenging issue for sure. We've also presented litigation to the Supreme Court, as has the UCA, the University of Central America. They presented a habeas corpus demanding the release of certain prisoners because of the conditions in the COVID during the COVID lockdowns, and those are claims that have yet to be resolved.
Thank you. I want to remind our audience, if they have questions, to please comment them in the chat, and we can answer them in a while. We have one more question, so if you have them, please share it with us. I want to talk about, there's the campaign La Partida from Cristosal. It's a campaign to, again, shed light on the internal displacement law in El Salvador, and how is the COVID affecting the success of this campaign?
Well, that's a really good question. One of Osvaldo mentioned vulnerable groups, and one of the vulnerable groups that we've identified are internally displaced people and deportees. Then, for similar reasons, because their life projects were destroyed prior to the pandemic, and therefore they have less resilience, less savings, less reserves less social capital to be able to, withstand the economic lockdowns. And so prior to the pandemic, we had helped relocate 52 families in El Salvador that were internally displaced. And we had been monitoring what we called the progress made towards durable solutions, so reintegration into other parts of the country based on security, economic, sort of social indicators. But when the lockdowns happened, basically all of that kind of more development type work, humanitarian assistance work, reverted back into trying to address a humanitarian crisis and keeping these populations stable, fed, and one of our big concerns is that that when the lockdowns are lifted, when the borders are open, there could be this potential for pretty large outflows of migrants and refugees stemming from the region and heading north. So that's one of the things that I think we need to keep on advocating for in the United States, is that in the new administration or in the continuation of the present administration, there will most likely be a humanitarian crisis again at our southern border in the form of migrants and refugees. And those are things that we need to keep our eye on. In terms of advancing with the law, one of the things that we've seen here is that the president is the new president, Bukele, is the one who signed the special displacement law, which was part of the goal of the Partida. Partida was an animated film about a Supreme Court case that we won in representation of families internally displaced by violence, which established sort of the rights of internally displaced people in El Salvador, but put obligations on the state to improve response. And one of them was to create the law. The law was passed and signed by President Bukele, but I think that the actual commitment to assisting victims of this administration is expedient in the sense that, similar to countries that have liked to use the war against terror to crack down on opposition, to centralize power, to restrict certain rights, they advocate for those governments like Egypt or things like that. They advocate for the rights of victims because the existence of victims justifies the increasingly harsh crackdown or wars against internal enemies that they're waging. And that, I think, is how President Bukele framed displacement. His real displacement response was going to be to win the war against the gangs. And the reality of that is that gangs are not weakened at all in El Salvador. Homicide rates have changed, and that's always been something that's hard to explain to people. But the gangs' presence in territories is, as far as we can see, unchanged. And according to the International Displacement Monitoring Center, last year almost 500,000 Salvadorans were internally displaced by violence. So again, as I said, the commitment of the president was sufficient to sign a law, but they cut the budget for the Victims Assistance Program, and they haven't created a policy specifically for addressing victims. And so those are kind of the setbacks that we see. Osvaldo, do you want to talk about the National Institute for Victims in Guatemala?
Yeah, sure. All the institutionality about victims in Guatemala is in the process of redesigned. Just a month ago, a new law was ruled creating the National Institute for Victims. As Cristosal, we are working with them because they are designing the basic processes and methods for the new institute. And we are hoping that this new institution is going to bring a more integral response to victims in general. Before that, in general, victims don't have any protection from the state. So we are helping them in different ways for strengthening their capacities, for sharing our toolbox, our lesson learned, and experience in the human rights defense in the region and also in the country. So we are expecting that this new institute is going to start to work on September.
Thank you. We have one question from Catherine Sampek, and she talks about food scarcity and food justice. What is the situation in Guatemala or Salvador with food scarcity? You mentioned the white flags earlier before. Could you describe it a little bit more so our audience has a little bit of context on that?
Osvaldo?
Yes, when I started, I said about the malnutrition in Guatemala. We can find some communities in the country with 80 or even 90% of people are malnourished in general. So this is a general situation, and it's quite different to the situation in the US. When we are talking about or discussing the situation of indigenous population in general, but young indigenous women living in rural areas, the indicators are the worst and is linked with migration in general, as a structural phenomenon in the region. Malnutrition is also a huge problem in the urban areas in Guatemala. So the impact of the lockdowns and the curfews combined, has been really devastating, and still is, because the majority of people cannot go out for food, for water, for survival. So at the end, this situation generate this humanitarian crisis that we are witnessing, and Noah said. In general, the lack of food insecurity, it's a major trend in the Northern Triangle. But considering the more rural population in Guatemala and the indigenous conditions in general, the situation is really worrying and is getting worse. About the chain supplies and etc. We have to say that in general, some part of the private sector and corporations in Guatemala, but the same situation in Honduras and in El Salvador, pressured really hard the government for avoiding the lockdowns. They wanted the machine still operating and the companies functioning business as usual. So at the beginning of the pandemic, we saw the tension between government, some authorities prioritizing life and healthcare situations, indicators, and maybe these more scientific and reasonable ideas of managing the pandemic when managing the pandemic. But on the other hand, this really huge pressure for continuing business as usual. So during the 3 first months of lockdowns, the healthcare intentions, initiative, and guidelines were the main drivers in the management of the crisis. But 3 weeks ago, the country was literally open, and we are witnessing thousands and thousands of people in the streets just looking for survival. And we are expecting, obviously, a profound increased number of cases in the country. We have to say that the healthcare condition, as I said, prior to the crisis and during the crisis, are really incapable of responding to COVID-19. So we are really worried about the future of the crisis, maybe on September, or we are still waiting for the peak of the crisis because it's always in the future and it's always to come. But in general, to summarize, malnutrition was a big problem in Guatemala, and the situation is going deeper. And in general, the pressure from private sector for maintaining business as usual is really, really affecting the capacity of reducing the impacts of COVID-19. Obviously, in parallel of the really, really low capacity of responding from the healthcare institutions in the countries.
Thank you. I don't think we have any more questions from our audience. I would like to say, there's one more. Yeah, it's a thank you from Catherine. So I would like to say thank you to Vanderbilt University, and thank you to the Stone Center and the Tulane University for their sponsoring this event. Nola and Osvaldo, thank you, muchas gracias. And that was it. I appreciate it. Have a good day.
Thank you all.
Thank you.
Thank
Thank
you.
you for your interest.
Thanks, everyone.
Bye.
Bye-bye.
Take care.
Take